Hello, students, and welcome to week 6. Week 6, we're going to be focusing on chapter 6 in our textbook. The title of this chapter is Medical and Psychiatric Approaches and the Person in Need. So we're going to focus a little bit more on the medical aspect of human services. And so each chapter, begins with questions to consider. So as you're reading this chapter, why is a basic understanding of the medical and psychiatric models important for human service workers? How does HIV/AIDS illustrate the relationship between the medical and psychiatric model and human services? So we're going to talk a little bit about the history of that illness. And what are some of the common treatment strategies of the psychiatric model? And now remember, psychiatric deals with psychiatric medications. And so psychiatrists are medical doctors who can prescribe medication. And so this wouldn't specifically be mental health counseling or psychologists, which do more assessments and things like that. And so it starts off with a little case about Robert and gives a brief introduction to the chapter, which is followed up by a discussion on AIDS. And so it's physical disease as a human service issue. And so in discussing the history of AIDS and HIV, it talks about ways in which human services really became involved in psychiatric treatment, medical treatment, because when, those of you who are old enough to remember when we first started seeing cases of HIV and AIDS, and the medical profession was trying to figure out what was happening and how it was transmitted and all of that stuff. Sounds familiar to this year, right? Human services got involved because there were certain populations that were at a higher risk of developing or transmitting HIV and AIDS. And so there were behaviors involved in it, right? And so, people eventually, we learned, could take precautions to potentially prevent themselves from getting HIV or AIDS. So in that, it became a human services issue as well. All right, the basics of the medical and psychiatric model. So it goes back to kind of the framework of what the medical model is, and therefore the psychiatric model, since that falls under medical. So it talks a lot about the terms of like pathology, symptoms, diagnoses, things like that. And, the importance of the use of the medical model within the field of human services. It goes on to have another vignette and talk about another individual and the impact of treatment with them. Again, a medical issue that also would be a human services issue. The next section talks about common treatment strategies of the psychiatric model. And so some of these may be things that you've heard of in the past, and you may have some biases sort of for or against some of these treatments. So like the first one is ECT, which is electroconvulsive therapy, which has been somewhat controversial over time. It was used a lot in hospitalization settings and things like that. And a lot of times it was used inappropriately. However, there are a lot of benefits to using this with certain clients. And so it talks a little bit about that and gives a vignette related to ECT. The next is chemotherapies. And so what the chemotherapies are drug treatment. And so this is where you think more commonly about psychiatry as a field, where they're prescribing medications that might be anti-anxiety medications, antipsychotics, atypical antipsychotics, antidepressants, anti-manic mood stabilizers, and some common usage of drug therapy. And so it differentiates these different categories and what they do. And so anti-anxiety agents obviously would be used for anxiety disorders, which could be any number of generalized anxiety. It could be specific phobias, it could be PTSD, hoarding behavior, things like that, OCD. And so it lists a number of medications that there's a table on page 106 that talks about some of the common generic and trade names of medications that fall in those categories. And so antipsychotic agents, they're often called psychotropics. Those in atypical antipsychotics are more for individuals who might have hallucinations or delusions, people who might be diagnosed with certain bipolar disorders, and where they have the psychotic features, schizophrenia, things like that, sometimes other cognitive disorders, that these could be prescribed for. In some cases, however, they're also can be used in small doses with antidepressants or anti-anxiety medications. So sometimes these help with like sleep issues and things like that, that can be, again, combined with antidepressants and mood stabilizers. And so it's kind of an idea. It also, on page 107, is a little chart that has some of the side effects, which is a really important thing to look at, because when we're working with individuals who may be taking some of these medications, they may report some of these side effects, and it's important for us to know whether it is related to them taking the medication, if it's related to their disorder, or something totally different. And so having a good idea of some of the impacts is important. Excuse me. Next, it talks about antidepressants. There are two main classes of antidepressants, tricyclics and monoamine oxidase inhibitors. So those are called MAOI inhibitors. When you use MAOI inhibitors, there's a lot of contraindications. So there's a lot of other medications you shouldn't use if you're using MAOIs. The other class, the tricyclics and stuff, there's actually two different. The one is SSRIs and one is SNRIs. So selective serotonin re-up inhibitor. So that works one way in your brain, and the other is serotonin norepinephrine. And so it works on two different neurochemicals in our brain. And so again, it's kind of important not to necessarily have such a great knowledge of all of these medications, whatever, because unless you're becoming a psychiatrist or medical professional, you're not going to be prescribing these medications. But just to have an understanding of the impact and what different medications side effects are and what they're typically taken for can be really helpful in our field. And then the next category, the anti-manic or mood stabilizers. Again, these are typically taken for bipolar disorder. Sometimes in small doses are also with antidepressants. So it sort of depends on the individual's specific complaints and concerns and what's most beneficial for them. And then again, the final kind of category under here is common usages of drug therapy. So it talks a little bit about different ways that things can be misused, like ADHD medications. Certain ones of them can be misused by people, and the impact of ADHD medication, so children who are properly taking it, what impact could that have on them for later? And then finally, the chapter ends up with prospects for the medical and psychiatric models, just kind of like sort of looking into the future, what direction is it headed? As always, the chapter ends with a really great summary of the reading, some recommended readings to continue, and then internet sites that might be useful for you, ones that you might want to check out this week. And then finally, if you have the My Helping Lab that goes with your textbook, it has some activities that you can do on there. And of course, you can always look at that anyway. It might be something that you can do without having the My Helping Lab to increase some of your understanding of the topics covered in this chapter. So any questions or anything, feel free to let me know. Chapter 6 begins the chapters that we're going to be looking at for exam 2. So exam 2 is going to cover chapter 6 through chapter 10. And so getting a good start is awesome. Make sure you do the online activity for this week, and you'll see another video from me come week 7. Thank you.